Welcome to this episode on male fertility series. I'm Dr. Suresh Nair. Male fertility is an increasingly big problem throughout the world. And it used to be thought that when a couple doesn't conceive, that it is purely a woman's problem. Almost 50% of the time, it's a male fertility issue. Yes, a good number of sperm conditions are reversible or sometimes they are treatable. We can overcome it. That means our final objective being to conceive a child. If someone has asked me to do my sperm analysis, let's say, what would they come up in terms of descriptive diagnosis, we call it? Okay, so there are a few terms that we use. For example, azoospermia, AZOO means no sperms in the count in the sample. Shocking, but can be due to blockage. It's obstructive, so we can either go to the testis and take it, or we can join up the tube. So it's not so bad. But then there's azoospermia, which is linked with primary testicular failure. That's can be a bit scary for men because that's really not a good diagnosis. Means that the factory is no longer functioning. The factory is closed down. Or if the factory is working, but the road from the factory to the exterior where they have to transfer the sperm is just traffic jam or blockage, that's easy. We can get around it, you see. But if the factory is gone, then it's scary. And sometimes the factory is still functioning, not enough to come out. That means it's still azoospermia, but when we go to the testis, we manage to get it. So at least now with technology called IVF, ICSI, men who could not father their children a short maybe 40 years, 30 years ago can still do so. They do not resort to donor sperm. But the vast majority of cases is something called oligospermia. Oligo is a word used to say lesser sperm, not as good a count. So sometimes, we need 20 million sperm as our threshold. It could be 15 million mild, 10 million and before below to maybe about 5 or 6 million moderate. Below 5, we start thinking about it being a problem. We start thinking about talking about please go for IVF rather than trying and trying and trying because you try too long, the wife is getting older, and then you get another compounding problem. Then there's a word called teratospermia, not terrorism. It's the teratospermia. Terato means misshapen heads. So they can have a large number, but they don't seem to enter, they're not functioning. And pretty common, in our country, we used to think many decades ago, are we overreading? So one center used to say, I can only find 1% normal forms. Am I overreading? Am I too strict or not? Actually, it's universal. A lot of teratospermia going on, mainly because of, you know, environment. Actinospermia is another one. Actino means they're lazy. They're not so active. They're not good swimmers. They're more relaxed. So actino. So just to revise again, Azo, no sperm. Oligo, little sperms. Actino, lazy sperm. Teratto, misshapen, ugly sperms. Actually, IVF or ICSI to be more specific, is not the only way we can handle, male reasons for not conceiving. There's something called IUI. Intrauterine means inside the uterus insemination, or I say for easy layman's language, inside the uterus insertion of the sperm. You see, sometimes you need to sort of turbo boost the whole system. We have women have the follicle, which is the egg bag coming out at the right time. And sometimes you find that because of the stress alone of, can you imagine the doctor says, okay, tonight must have intercourse, tomorrow morning have intercourse. And then the only thing the poor husband can think of is this boss's face yelling at him, where's my report? So, I mean, it's a bit difficult. But he's able to then come in, give a sperm sample by ejaculation to the lab. The lab processes it. How do they process? They get the the most active sperms. They have the sperm gradient, they call it. They put it at the bottom and let the sperms all swim up, and then they skim off like skim milk, get the best of them, put it in a small little amount of fluid, and then they give it to you in a little test tube, and we take it through a little, a very fine tube. It can be done in the clinic. When we trigger means we help women to ovulate at the right time. At the time of ovulation, you can't hit it spot on, but we gently release the sperm in the upper reaches of the womb. So it's like if you had a set of, I always draw this analogy for my patients. Suppose we wanted to go to send my commanders to Penang, let's say. So they march from Singapore all the way to Penang. All the best ones will go, will be lost along the way, right? So if I airlift them from Singapore and drop them in Penang, they can go and have their Penang laksa after that. So I just feel that IUI is good in appropriate circumstances. The doctor will decide and help the couple to know when it's a good time to try IUI. But IUI is not that efficient. At most, it just brings you back to what normal pregnancy rates are, maybe between 18 to 20%. But if the sperm counts are reasonable, at least 10 million above, reasonable to do. Even 5 million, we do try, before resorting to IVF. Some couples, they're fortunate, may conceive, so we give them a chance. However, you must look at the couple as a couple. If the wife is much older or has been trying for many years, duration of not conceiving is a very important factor. We must place a lot of attention to that. If a couple has been trying 6 months and they want to do IUI, reasonable. But if a couple has been trying 2 years and they want to try IUI, I would say, guys, maybe we better not waste any more time. Honestly, the most efficient way of conceiving today, hands down, is IVF, particularly ICSI. No doubt about that. Because we take the best sperms under microscopy, we look at the best looking sperms, most active, and sometimes we do certain function tests. I'll just rattle off some words. Annexin 5, MAC annexin 5, PIXI, IMSI. That means we magnify the sperms to look at the very detailed structure. We use PIXI. Remember earlier I said that if you have the artificial eggshell, the GPS is good to swim to the hyaluron and it sticks there, right? Then what we do is, as the name implies, PIXI, right? PIXI with P there, PIXI. We pick them up from there. So they have another level of screening. This is only for IVF. For IUI, we just get the best, the fastest sperms, you see. And then when we look at the main decision making, IVF or IUI, the doctor will have to sit down and look at all the other factors as a couple. What's the best for the person? As a basic principle, I am a strong believer of antioxidants. Antioxidants like CoQ enzyme for both men and women actually is rather useful because they are counter to the free radicals that are in our environment. But zinc, selenium are also just as important to add in your sort of collection of things that you want to take. Vitamin B12, folic acid as well. For men, is also quite important. And so these are the general sort of supplements I suggest. But I am very pro diet, having a proper diet. Balanced diet meaning a bit of fish, meat, not excess proteins. Excess proteins apparently can impact on your sperm counts as well. So all of these diet fads, keto diet, no carb, mostly proteins, actually detrimental to sperm, let alone your overall health as well. So first and foremost, good health practices, adequate sleep. because without sleep, and we take it for granted, it's a very fundamental thing. There's no regeneration, there's no repair going on. And we got to get good REM sleep, deep sleep for a certain duration, at least 8 hours or so. And all of this, our stress hormones will be decreased when we have adequate sleep as well. Obesity is one of the most potent reasons why infertility in males, especially because derangement of the hormones like insulin resistance, you are more likely to be diabetic, maybe hypertensive, maybe having to take a lot of other medications, and heat. When I'm fat, my body heat is in that area is going to be higher, and it will cause problems with fertility. My sperm count will be affected, and that's a clear thing. It has been shown in many studies beyond a certain BMI, sperm effects are seen. But same overdoing things as well, excessive exercise, too much heat, bicycling, running, and some of my very athletic husbands come in and say, cannot be. I am so fit. I am strong. I work out every day, 2, 3 hours in a day. How can you tell me my sperm counts are low? But the fact is, it is. So when we tone down some of the exercises in moderation, maybe notch it down to 70% of what he was doing, the sperm counts improve. You see, so it's not a given that being so ultra fit is going to translate into good sperm counts as well. Smoking has been linked to lowering of testosterone, resulting in lowering of the libido and also erectile dysfunction. So I think that's a known phenomenon, and that's clearly detrimental to trying to conceive. So um, no smoking. So if we have very low sperm counts, not to worry. There's a way to go upstream, as it were, to the testis, and it's a very simple 10-minute procedure where they just make a small look, put a little bit of local anesthetic, put a little needle inside, very tiny, tiny, tiny needle, suck out some of the tissues and the sperms, and we're done. It takes about 3 minutes. The other methods, like TISA, it's called TC, my urologist colleagues will explain to you. It's also quite simple and straightforward, can be done in the morning and then go home in the afternoon. It's generally quite an easy day surgical procedure. When a man realizes that he is the main reason why, his wife is not getting pregnant, he goes through first and foremost, I feel, a guilt trip, that she has to go through a whole lot of other things like injections, procedures, especially if we do IVF and ICSI. So it goes through that guilt, for a while. And also common association or linkage between fertility and virility. Are you man enough to make your wife pregnant? That's the thing that keeps them away from support groups like I Love Children and SD Fertility, so many support groups. Every center has got their support groups. A lot of fertility clinics as well has counselors and all. It's fundamentally that. A lot of times, so much focus is on women because they got to do a lot of stuff that the man is left hanging high and dry, both literally and metaphorically. And so he feels cut off. Although he feels that he is the responsible party, no one looks after his needs a lot of times because, again, his function is go to the room. It's called the production room, for one of a better word, and go and produce a sperm, and that's it. So he wants to do more. Sometimes some of my patients, doc, is there any kind of injection you can give me so I can share in what my wife is going through? So some husbands, they say, honey, I'm so sorry you're going to go through all of this. That's where the love comes in. The question I get asked all the time is because, when they come to see you, they want to get baby like yesterday. But there's a lot of groundwork. We have to investigate properly, and the investigations and tests must not only tell me why you haven't gotten pregnant. Upon getting pregnant, I must make sure I'm a safe mom to carry my baby through. All my vaccinations must be done. Even husband's vaccinations must be done because husband getting a viral infection can affect the wife too. You see, because of close proximity, right? So those are necessary things. It does take a bit of groundwork. Maybe in a couple of weeks, we'll know. We get an evaluation done. We do our evaluations quite fast. Then, if it is deemed necessary to do IVF, not a big issue. In Singapore, IVF can only be done by a trained and accredited, ministry accredited IVF practitioner in an accredited center because quality control and benchmarking and making sure all the success rates are high and also proper indication. Can't do IVF because I feel like it. So we should have all the indication. All this comes together in the fastest. Nowadays we have stimulation that is within 10 days you're ready to take out your eggs. So you start on the beginning of your menses, day two of your menses or day three. There's stimulation day one, we call it just S1. In about 10 days, the by giving injections daily, the follicles, which are the egg bags, are ready to have the eggs drawn out. How do they get the eggs drawn out? Is under light anesthesia, no major surgeries or anything like that. An ultrasound scan with a little tiny needle going through the vagina, doesn't need the fallopian tubes. You suck out all the eggs, it goes into a test tube, hence they call it the test tube baby. The test tube is taken, they put in a petri dish. The embryologist looks for the egg, it's like little tadpole eggs, they look at it, and then they keep it aside, simmer for a few hours. Then they clean the shell. There's always a lot of little cells around the egg. They look at the nice cleaned egg and they put the sperms and then they wait. They check the growth over 5 days to get a blastocyst. Sometimes day two, sometimes day three, sometimes day five. Each doctor and embryologist will decide for you. So in its fastest, within a month, in a fresh cycle, you can put back your embryo, and maybe downstream within the first 4 weeks from the start to 5 weeks, you can see whether you're pregnant. That is an ideal circumstance. But honestly, these days, we don't do that often because we want to create more embryos and do what is known as embryo banking. And because our freezing technology is so good these days, our embryos have a high survival rate so that you don't have to go through the whole rigmarole of stimulation and all that. And sometimes your womb needs preparation before we can put in. We don't want to put it in a hostile environment, right? So we prepare that, but I can keep my embryos however long I want. And thankfully, the government has now allowed us to keep our frozen embryos longer than 10 years if we have good valid reasons so that a couple can continue to have children, you see. So in its fastest, but there may be instances where a lot of groundwork has to be done. So we create the embryos first, then maybe she might have a cyst or a growth that needs correction. Sometimes endometriosis, maybe she's failed many cycles before. Some couples come to me after not being successful elsewhere. We know that they need their plumbing, so to speak, corrected. And sometimes we do what is known as endometrial receptivity assay. Is my womb in the good window of implantation? That's a test we do. So all this takes time, and sometimes maybe embryo is put in 2 or 3 months downstream, but usually very quickly, within about 3 months max, we tend to be able to put back our embryos, and hopefully we get pregnant. I want to show you this next slide that I'm going to flash about the impact age in men makes in the sperm parameters. Let's see the slide. So if we look at the slide, the level of testosterone declines as men age, and this is linked with the ability to produce sperms. It affects sperm volume, it decreases the movement of the sperm, and also most of the shape of the sperm cells or sperm heads are affected as well. This is well proven. After 40 years of age, you have more DNA damage, and this will result in decrease in movements and how many of the sperms that are eventually alive, viability. It also increases the time that he can make his wife fall pregnant. For example, men more than 45 years of age, the partner's relative risk of an increased time to pregnancy over 1 year increases 4.6, and over 2 years, it escalates to a whopping 12.6 as a factor. So older populations tend to consume more alcohol, have intercourse less often, and they tend to use contraceptive for a longer period of time. And then smoking can be a problem as well. Another important statistic is the probability or the chance that a couple that seems to be fertile will take more than 12 months to conceive, nearly double from 8% when a man is 25 years and younger to almost 15% when he grows older than 35. I think that thus far, this is a rather new phenomenon. There's no clear sort of guideline from the colleges, but overall, because COVID can make quite an impact on your whole health. And as I mentioned before, if you have any major illnesses and fevers and all, it takes almost 3 months for the new generation of sperms and all that. So you see, first month you get the COVID, you're quite tired and weakened. The second month you're just getting back to normal. I think from the third month onwards it's okay. But when we're doing IVF and all that, it's an ongoing thing. We always do some checks of the parameters. If it's not so badly affected, we are worried about too long a duration that might decline your fertility. So overall, a couple of months is the usual answer I give. 2 months later, you can, try again. In regards to COVID as well, I can't overemphasize the importance of vaccination. The disease is worse than anything that you might read about vaccination. The condition, getting COVID, be it the Delta variant or Omicron variant, it's quite detrimental to our body and can, in some instances, we are unlucky, we get a bad sort of outcome. So vaccination to date has not been categorically proven. There's some, anecdotal statements here and there, but no one has categorically come out and said vaccination definitely impacts on sperm parameters. So far, none. Okay, so I think between the two, I'd rather have full vaccination that protects me, my health, and my sperm quality and counts compared to getting a bad COVID attack. What is meant by secondary infertility? I mean, it's not a desirable word. It just means that when I first got married, I could get my baby quite easily. Then after that, it didn't become easy enough. Something else must have happened. Now, it's very hard for me to give you a statistic. I mean, it depends on the population dynamics. So many factors, so many confounding factors. You can have a situation where most of the couples that have their first baby are of the later 30s. And so clearly they have a higher incidence of secondary infertility. If you have all the couples having babies in their mid 20s, then there are less who will have problems with their secondary infertility, as it were. So, what are the causes? It could be all of the causes that causes first the problem in the first place. So, that is the tremendous power of IVF. For example, I always tell my couples, you freeze your embryos, right? And I always tell my couples, you're already 38, you're already 35. I know your temptation to quickly conceive is so tremendous, but try to get a few more embryos frozen because next time around you can conceive quite readily because we got embryos frozen. Number one, don't wait. Number two, don't just not wait and do nothing about it. Go and see a doctor who is specializing in fertility. Go to places where they have what's known as fertility screens. There's many sites that can give you advice. I Love Children, SG Fertility, Singapore Fertility, so many websites, and we are blessed because we have a good number of good top-notch IVF centers and fertility centers in Singapore. Go and get help early.